So basically, I'm head of the department for hair transplant, and hair transplant is actually one of our most popular departments here because hair loss is very prominent in this region. Although hair loss and pattern baldness is mainly associated with men, a large percentage of females also have some level of hair loss. It's estimated 1 in 5 women will have some level of hair loss throughout their lifetime. There are numerous causes of hair loss, such as some sort of deficiency, such as vitamin D deficiency, vitamin B deficiency, iron deficiency, but mainly it's correlated with the hormonal imbalance, and in vast majority it's directly inherited, so it's inherited hair loss. Genetic hair loss can be passed on either from the mother's side or the father's side, and it doesn't have to impact every person in the family. It could be very random, like anything else when it comes to the genetics. And genetic hair loss typically, the reason it's called pattern loss is because it mainly affects the top regions of the head. So the thinning can be very gradual over time, and it can be very rapid. And there are numerous treatments nowadays because the medicine keeps evolving. We're coming up with more advanced technologies and treatments to treat hair loss and to prevent further thinning. So we specialize in different kinds of treatments that we're customizing depending on the case. So we first start off with a blood test to pinpoint whether there are any sort of deficiencies, and if we find that there are no deficiencies and there's no problems, so for example the polycystic ovary, and if there's no thyroid problem, then we simply contribute that to the genetic hair loss. And usually a lot of the cases, even when we see the patients, they come in and they will say, yes, my mother has it, my sister or my aunt, things like that. So it does run in families. For ladies, we can start off because the follicles that have been lost when there is major thinning and there are already patches appearing, which can also, by the way, be to overprocessing, chemical overprocessing, straightening of the hair, things like that. If there are patches that are already showing, we start by the transplant, because the only way to permanently restore the hair and to bring back the volume is to actually transplant and add new follicles. But afterwards, we take proactive measures to prevent further thinning by stimulating the remaining hair that's surrounding the area of loss. And that is usually done through growth factor therapy, which consists of micro-injections on a monthly basis directly to the follicles to stimulate the follicles to reactivate the natural stem cells to revive the lost, to revive the hair. And that usually is done on a monthly basis, once a month for about 5 to 10 months depending on the case. In addition, we prescribe supplements, and also a very good treatment that has been proven and has been for a long time on the market is the minoxidil. So minoxidil is a natural vessel dilator which is improving the blood circulation. So even for ladies, we're still asking them to just make it a part of the daily routine, because hair loss, like anything else, if it's inherited, if somebody has a genetic predisposition to diabetes, then that person needs to take the proactive measure to stay healthy, to not develop the diabetes. So the same thing for hair loss. If it does run in the family, one should always be proactive. So in the first signs, it's always better to prevent rather than to treat. Hair transplant, basically, the simplest ways to put it is supply and demand. Naturally, the hair which grows from the hairline all the way to the crown, so it's the top 4 regions of the head, is the hair that's primarily affected by hair loss, because the follicles are genetically inferior to the hair which grows on the sides and the back. So the hair which grows on the sides and the back is classified as the donor dominant hair for 2 reasons. So the first primary reason is the follicles are genetically superior because they are resistant to any hormonal changes in the body. More specifically, the follicles are resistant to the dihydrotestosterone. Secondly, all of us have approximately 10 to 20% extra follicles right around the outer margins of the head compared to the top. And we can all feel it even when we're brushing the hair, when we're styling, the back tends to even grow a bit faster compared to the rest of the hair. So this is the genetically superior hair of which we have extra. So the natural way the natural concept of transplant is to take some of the excess follicles that we have, which are genetically superior, and to redistribute them in the areas where we're thinning, which tend to be more obvious. So to have loss of density here, yet to have extra follicles here, naturally it is better to transfer these follicles and increase the volume in the front, which is most important for ladies, because when we're styling our hair, if we want to part it down the middle to have the broadening or the thinning, it impacts our lifestyle and it limits our ability to change our hair. So of course, when we're working on female hair transplant, we're focusing on adding extra volume right down the middle, so that gives them an option of styling the hair naturally. The procedure that we're specializing in, it is known as the stem cell FUE. FUE stands for follicular unit extraction, which is classified as a minimally invasive to non-surgical form of hair transplant. Traditionally, this is a technique called FUT. The traditional technique we use to basically excise the tissue from the back, which is known as the strip method. And then the strip needed to be dissected into small individual grafts, which are then transplanted. But of course, this leaves a scar, and with any surgery, there are some side effects. As far as FUE is concerned, all we need to do is shave a small section right at the back, so basically in the middle. So we leave the bottom part of the hair, the top, which covers it, and this of course will grow out. So we will need to shave about 2 inches section at the back of the head. We will apply the topical numbing spray, which will numb the skin, followed by local anesthetic, which is the same concept used in dentistry. Once we numb the area with a very fine instrument, we're going to just go in and extract the individual extra follicles. So the whole point is, like, let's say here we have 80, for example, grafts per square centimeter. At the back we might have 100. So we'll just focus on taking out these excess follicles. And then the same thing here. We'll part the hair, we'll pinpoint where the gaps are. We'll numb the area locally only. We'll create small incisions in the skin, not very deep, about 1 millimeter underneath the skin, and we'll just implant the follicles. In about 2 to 3 days, the skin will entirely close to absorb the grafts, and we do active follow-up. So, for example, the 3rd day, we'll bring the patient back for the shampoo. They can join back work and resume normal activities almost immediately, because again, physically nothing is happening. So it's a minimally invasive procedure. The hair will start to grow about a month after the transplant, approximately 10% per month. So typically we need to give it about minimum 6 months to start seeing about 50% of the outcome, 1 year to see 100% of the outcome. Transplanted hair can be treated naturally, it can be colored, it can be highlighted, and in most cases it is permanent. So the first month, the only restriction is, for example, one should not go swimming, because salt and chlorine are damaging to the follicles while in the initial healing stage. And one should not be directly exposed to the sun for more than, let's say, 15-20 minutes at a time. So typically the beach should be avoided for the first month. Everything else, normal activities, can be resumed after 1 month, including coloring, highlighting, everything else, blow drying, everything else. And because this hair is genetically superior, the patient will feel a lot more thickness compared to the other hair. But because we always believe in a dual approach, transplant is just the first step. So the first step is to fill in the hair that has been lost. Stage 2, we start bringing patients back about 2 months after the transplant on monthly treatment, which consists of growth factor injections, which are 1 millimeter deep injections, similar to mesotherapy, but a lot more powerful. So basically we will target all of the surrounding native hair to prevent further thinning. Because let's say if somebody has thinning right in the middle, which is typical for ladies, and let's say we do the transplant right here in the middle, that area will be resolved by the transplant. But then if they have the genetic predisposition to hair loss, it means the rest of the hair the thinning will start to spread. So even with the transplant, we need to make sure that the surrounding hair gets stimulated so that we can prevent further thinning. The patient is fully awake throughout the procedure. They will watch TV, they will listen to music, they can talk on the phone. They will have lunch and plenty of breaks in the process, but it does take anywhere from, let's say, 4 to about 8 hours to complete, depending on how big of an area we're working in, because it's a very artistic process, and because we try to make it as comfortable as possible for the patient to allow him or her to move around, to stand up, to stretch, things like that, have all these breaks in the process. So with all of these breaks, it's considered a full day procedure. But the patient goes home the same day. There are no special precautions in terms of what to do or what not to do. The fasting is not required. It's a day procedure. So the patient will go home. He or she will return the next day for the head wash. Once the skin completely closes to absorb the new follicles, which is 48 to 72 hours post-transplant, the patient returns for the first hair shampoo, during which we will teach him or her how to properly and gently shampoo the hair in the initial healing state of the skin. The patient will return back on the 10th day, so we will exfoliate the area. We remove any crusting which forms around the implantation site. From that point on, there's no need to come back at all. The next follow-up will be after about a month, which is about the day number 40 to 45, during which we start treating the existing hair, not the transplant hair, but the original hair, to stimulate and to prevent further thinning.